Hi everyone, it's Lisa Moeller with Medmark, and welcome to another edition of DocTalk Dental. Today I'm honored to be chatting with not only one but two of our favorite doctors, Dr. Tom McClammy from North Scottsdale Endodontics and Implantology and Horizon Dental Institute. Alongside him today, Dr. Enrico DiVito from Arizona Center for Laser Dentistry. I'm proud to call both of them my longtime friends. Welcome, Dr. McClammy and Dr. DiVito.
Thanks very much, Lisa.
Thank you. Nice to be here.
I'm so glad to have you guys here with us today.
Thank you.
We're excited.
I've known both of you for too many years now.
Yeah, too many years. That's probably right.
We probably don't want to count them all, right?
Wow. Time flies.
So we've included Dr. DiVito today. Dr. McClammy, of course, has been on DocTalk Dental with us for a few times now.
Yeah.
We want to talk about your gentle wave courses and Sonendo and how you guys are incorporating those into your practice, and whoever would like to start first.
Dr. DiVito?
Great. Well, I'm a general dentist. I've been practicing in Scottsdale for 37 years now. And I've really tried to keep up with all the latest in technology. As you heard, my center, I recently changed the name to the Arizona Center for Laser Dentistry because of my penchant towards doing dentistry using lasers. And those of you who may recognize me know that I made some pretty huge accomplishments in the field of laser dentistry and opening that whole field back up again. But I'm particularly excited because Gentle Wave has been a new addition to my practice. And I must tell you that it has been a welcomed addition. It has raised the level of dentistry, particularly with endodontics in my practice, and I'm excited to be here to talk about it.
That's awesome. And Dr. McClammy, you've told us about Gentle Wave and how you've incorporated that into your practice. Can you expound a little bit more to our audience that maybe didn't catch the other episodes?
Thank you. You know, there's certain things that have happened during my dental career, and I've been practicing dentistry in one form or another for well over 40 years, and yeah, I'm getting to be kind of the old guard now, and which I'm proud of, happy with. And there's been certain events and happenings in dentistry that have had a profound effect on me clinically and in my ability to treat patients. And certainly one of those has been the dental operating microscope, and another one of those major game changers has been cone beam technology. I, by accident, saw the Gentle Wave procedure and became affiliated with investigating Sonendo and the Gentle Wave, and investigated further because of my passion for trying to do the very best that I could do clinically, because I felt like the better I do it, the better I feel, the better the outcome.
Right.
And I saw Gentle Wave, and I started to investigate it further, and I read all the literature, and then I incorporated it into my practice. And I've got to say it's been a game changer and a paradigm shift for numerous reasons. As you also know, we have developed a teaching institute contiguous with the physical plan of my practice, which was a dream of mine also.
Right. Horizon Dental Institute.
Horizon Dental Institute, because I feel like when we teach, we learn, and the one that learns the very most is the teacher. Always the case. The more you prepare and the more you teach, the more you learn yourself. Mm-hmm. So we, in conjunction with the other courses that we've had at Horizon, we've also developed some courses, of which we've had 3 now, of teaching and sharing the Gentle Wave procedure with both dentists and endodontists. Not to make some distinction there, but we've shared it with people that simply were in pursuit of trying to do better endodontics for their patients, themselves, and obviously their staff.
Right.
So it's been I've been in it now for 8 or 9 months, and I am just like Dr. DiVito. I'm excited about the potential that's there and what I've seen clinically, and I'm excited about the response from the patients and my staff. So it's I couldn't say more that it's a game changer. I feel confident about that.
But Dr. DiVito, as a general practitioner, tell us about how the Sonendo Gentle Wave how you've incorporated that into your office and the benefits.
Well, as Tom has told you, I started with PIPS, and PIPS was a form of laser-activated irrigation. And I was using that to improve our ability to clean and debride these very complex endodontic systems. And although PIPS was good, I believe the Gentle Wave is better. And the reason for that is both have pros and cons, but I believe that Sonendo is further along. And during this journey of me moving PIPS forward, I joined forces with Sonendo because I thought together we could create a more powerful tool to bring to the endodontic community, and that's what we've done. Mm-hmm. So I've always been talking about doing endodontics minimally invasively and trying to preserve the anatomy, and it fit right in line with what Sonendo's concepts were. They also were looking to do the same thing, only their mechanism of action using a closed system multisonic was much more further along. Mm-hmm. And I will tell you now that I've had a chance to use it in my practice, it definitely works. And it is a great experience not only for the patient, but for myself and my staff. And I've just been pleased overall. I'm a general dentist. I love doing endodontics. I always have. And I will tell you that now I find myself having the confidence to not only take on more complicated cases, but even retreats. And we all know that retreats are an animal all in their own. Mm-hmm. And I have been doing more and more retreats even with Gentle Wave. And the literature, as Tom has said, supports the claims of system disinfection and debridement, even to the level of dentin tubule sterilization. So I'm excited, and I'm using it every day, and I'm loving it.
Oh, that's awesome.
Yeah.
This is great information for our audience, coming from a true endodontist and also a general practitioner, and how you guys are using this technology in your practices. Their technology is amazing, and game changer is I think...
Let me clarify for just a minute, Lisa. A true endodontist, obviously an endodontist, you're talking about a university-trained endodontist and that's been to an endodontic residency. But I like to think of endodontists or endodontic clinician as that anybody that dedicates their time and their resources and their passion and their heart and their mind towards doing endodontic procedures like Dr. DiVito.
Yes.
He shares with me a lot of his cases, and I can tell you that there's a lot of his cases that most endodontists are not doing that nice a job with. So when I'm teaching and sharing and visiting and sharing all of this stuff about endodontics, I make no distinction about endodontist versus a general practitioner.
Right.
I was a general practitioner, and I was proud to be a general practitioner. I still am. I love dentistry, period, all aspects of it. Then I decided I wanted to be a BU shoulder endodontist, so that's what I did. But I still love dentistry, and I support anybody. As a general dentist, I was doing a high level of endodontics, like Dr. DiVito is now, and I support anybody that wants to go that direction. And so general dentists are participating in this adventure and this flourishing technology just as much as endodontists are.
Absolutely. So you guys are doing many courses on behalf of Sonendo and Gentle Wave at Horizon Dental Institute, and the two of you are doing some courses together, I understand.
Yeah.
You've got some coming up in November, December. Mm-hmm. Tell us a little bit about what you're doing with these courses and how the doctors can attend.
Thanks for the question, and if you don't mind,
go ahead, and then I'll
answer.
Chime in. Sure.
So, when there's new technology on the blocks, on the horizon, you might say, it's nice to be able to share that technology. We decided when I adopted Gentle Wave and accepted it and brought it into the practice to start sharing that with clinicians nationally, because that's where it's available right now. And so just prior to the AAE, we had our first course. And we formulated a course to do some didactic portion and then some hands-on portion and a lot of exchange and interaction. GentleWave, or I should say more accurately Sonendo, came in with the GentleWave consults and very much supported that course at Horizon Dental. So we brought in the units, we used Steve Buchanan's True Teeth, and we showed doctors not really how to use rotary instrumentation in the shaping procedure, because we can change that vocabulary now, but we showed them how the GentleWave procedure works on teeth. So it was a very simplistic but very effective way in a hands-on live demo to do that. So there's the didactic portion. We've also been privileged for the last 2 courses, because now we've had 3 of them, to have Dr. Mirzad come in from Sonendo, and he's explained how this technology evolved. He explains in thorough detail the mechanism of action. It's been very effective, because we dentists, we want to know what's going on, and we see what's going on, but we want to see it. And then we have coupled that with some of the literature that's out there to show, listen, this isn't just, we're not looking at this and seeing this. This is the science behind it, the SEMs, the things that show that, because we can look inside the root canal system when we're done, like, wow, there's the wow factor. It's so clean. Never seen cleaner systems. But what's happening, quote, past that first curve? We know from the science that it's also clean there. So it's brought about challenges. It's brought about changes in how we're teaching it and how effective we're doing with it. And I think that each course that we've done has gotten just a little bit better. And I'm looking forward to the next one, because I change what I'm doing to be more effective as a teacher, but as I do it, I learn more.
Right.
I think also, Tom, it's important that we tell them that in addition to just showing them hands-on, the last several classes we've had, we actually have live patient demonstrations in which Dr. McClammy will take a patient, and in his all-world, all-star facility, I'm telling you, it is over the top, the facility, we can be in another room while Tom is treating that patient using GentleWave in real time, and we can talk about what he's doing, etc., in the comfort of the room outside of the dental chair. And it's very, very powerful. I've gotten a lot of feedback from our doctors saying that live demonstration really put it all together for us. So it's truly a show and tell from start to finish, and it's a 1-day course. It's not a 2-day course.
Full-day course.
And I believe that anybody who's interested in GentleWave should definitely attend one of these courses so they can see and touch and feel right up close what's going on, ask the questions that they'll have, because there are many, and then they'll be able to make an informed decision of whether or not GentleWave is truly something they want to incorporate in their practice.
Right.
I might add with that, I've kind of forgotten about the live demo. We've done that each time. It's been very effective. You know, you have to be able to walk the walk and talk the talk, but we're doing it live. So in a live demonstration, anything can go any which way. But fortunately, things have gone very smoothly, and it's been very effective. In addition to that, which is not a big thing, but it is a big thing, Horizon Dental Institute is fully accredited by the ADA as well as the AGD for CE credits. So doctors that come there and take a course of any kind, they're issued a certificate with X number of hours of continuing education.
That's huge.
So it is huge because we only have X amount of leisure time when we're not treating patients. We've got family time, we got all kinds of interests. And if you're going to spend your time, we all need CE hours too. So I always have way more CE hours than I need, but it's nice to be able to offer that.
Absolutely. So horizondentalinstitute.com is where they can find more information on your courses. And subscribe to Endodontic Practice for more information. Well, this was so much fun, you guys. I'm so honored to have both of you sitting here with us today. And again, the relationship we have, I've appreciated over so many years, and you're welcome back anytime.
Thank you very much. It's
thank
been
you.
a pleasure. I've been here
About
maybe more.
5, maybe more. I still owe you the award.
It's been great. I'm into awards. Anytime you give me an award, I'm
Most time on
all about
DocTalk.
appreciation.
Absolutely, absolutely. All right, well, we'll see you guys again back soon. Thank you so much, Dr. DiVito and Dr. McClammy.
Thank you, Lisa.
See you
Thanks for
soon.
having us,
Okay,
Lisa.
bye-bye.
All right.
So that'll do it for another packed edition of DocTalk Dental. I'd like to thank our special guests today, Drs. Tom McClammy and Enrico DiVito, for joining us today. To reach them for more info on Horizon Dental Institute's upcoming courses, please go to horizondentalinstitute.com. For more info on Dr. DiVito's practice, please go to drdevito@azcld.com. We'd also like to thank our sponsor, Sonendo, for helping us bring this important information to our endo community. For more info on Sonendo products, please go to sonendo.com. And as always, for further info on everything endo related, please go to our website and subscribe to our publication, Endo Practice Magazine, at endopracticeus.com. We look forward to seeing all of you again next time. Thanks so much for joining us. Take care, everyone.